Did you know that this year 1.25 million Americans will have a heart attack? That's a heart attack every 25 seconds. Of those having a heart attack, 1/3 of them, or 425,000 people, will die. It's the #1 killer of both men and women. Many of you have been told how you can prevent heart disease by your conventional physician. Eat a healthy diet. Lower your cholesterol with statin drugs like Lipitor. Exercise more. Reduce your stress. And don't smoke. Heart attacks are caused by coronary artery disease, a blockage of the arteries of the heart. The medical term for this is atherosclerosis. Today, Dr. Don Ellsworth has joined me to discuss the causes of heart attacks and the effective measures which you can take that will prevent coronary artery disease. Dr. Ellsworth, thanks for joining us.
My pleasure.
Can you give us 6 pointers on preventing the development of coronary artery disease?
Be my pleasure. Coronary artery disease can be prevented with some natural thyroid hormone supplementation, with testosterone supplementation in men. In women, progesterone and estrogen supplementation, vitamin and mineral supplementation, the elimination of toxins from the body, and the elimination of unnecessary prescription drugs.
Dr. Ellsworth, are individuals that have hypothyroidism at risk to developing coronary artery disease?
Very much so. As recently as in the Hunt study in 2008, they showed a 1.69 increase in hypothyroidism-related coronary artery disease. And actually, Dr. Hotze, this was with normal labs, but within that range, as you got more hypothyroid, the risk went up dramatically.
Why does hypothyroidism lead to coronary artery disease?
Hypothyroidism is well known for causing the deposition of mucin in the coronary arteries. Mucin causes injury. These mucopolysaccharides are a big part of the reason. Also, if you're at risk if you have hypothyroidism, there's more infections. More infections means more inflammation.
Well, are there any human studies that show using desiccated thyroid hormone decreases the incidence of coronary artery disease?
Very much so. Of course, Broda Barnes gave us some great information when he looked at autopsy results and showed that there was a huge reduction in coronary artery disease when you supplemented with natural thyroid. In fact, he saw that there was a 94% reduction, and more recently, Dr. Wren showed a 44% reduction using natural thyroid hormone supplementation.
That was with desiccated thyroid hormone?
Real thyroid, desiccated thyroid.
Now, can testosterone help in the prevention of coronary artery disease?
Well, you know, testosterone is the hormone that men associate with being buff, being in good shape, and our heart is in good shape when it has testosterone. It beats stronger, it beats more efficiently. So you can actually show that men who have coronary artery disease, if they are given testosterone, they can then get on a treadmill, exercise, and they don't show the same problems, they don't show ischemic changes. Also, we know that because it's beating more efficiently, they tend to feel better, and you can see coronary arteries actually dilate under the influence of testosterone. So it's the perfect answer for coronary artery disease.
And female hormones. How do female hormones adversely affect a woman and cause her to have an increased risk of coronary artery disease?
You know, that's been a question that people have wondered for years, because everyone knows that women before menopause, they don't have heart disease, whereas postmenopausally, there's a huge increase in coronary artery disease. What's going on? Well, we now know inflammation is the key factor. When women have a drop in their key hormones, progesterone and estrogen, their inflammation throughout their body goes up. This inflammation injures their coronary arteries, causing atherosclerosis. So putting back in the real hormones can be a real advantage to women.
And what kind of toxins are in our food or in our water that could cause harm to our coronary arteries?
Well, that's a long list, but some of the key ones that we're adding to our water would include chlorine and fluoride. We know that you can cause coronary artery disease just by adding chlorine to the water. So tap water should be avoided at all costs. Tap water is also very acidic, which puts a real burden on the body. It's going to be oxidizing.
And what kind of vitamins, minerals, or nutrients could we use to detoxify the chemicals that we get from the pollutants in the environment?
Well, one of the backbones of what we use to help folks is our Power Pack, and our Power Pack includes selenium, which is a natural detoxifier. It's also going to have fish oil in it, and omega-3s are very important at decreasing the risk of coronary artery disease. There's L-taurine present, CoQ10, which tends to decline with age, and of course statin drugs deplete CoQ10 as well. And we also use vitamin C, vitamin D. Vitamin D has been strongly associated with some protective effects.
And we have learned over the last decade or so that there are pharmaceutical drugs that are prescribed regularly by physicians that have been shown to cause coronary artery disease and atherosclerosis of other arteries in the body. Tell us about those.
You know, we always think that we can develop a drug which will improve one part of the body and the rest of our body will be perfectly fine. We've learned that we can't outsmart the way we were designed. If we add a drug like Vioxx, we reduce a certain enzyme.
Which was an anti-inflammatory drug.
It was designed to be a upgraded anti-inflammatory that had less problems with ulcers. Well, the problems with these COX-2 inhibitors was it increased the rate of coronary artery disease. So you had less pain from your arthritis, but unfortunately,
you died of a heart attack.
And that took a while to come out. And when the information first came out, it was actually suppressed. Then we come along and we
the drug companies suppress the information?
Shocking. Vytorin then comes along as the drug to lower cholesterol. We saw the ads. Well, it turns out that in one major study, the thickening of the carotid artery actually was worse in the Vytorin group than the placebo group. So drugs that were designed to reduce cholesterol actually accelerated atherosclerosis. And the list just goes on and on.
Well, then could you summarize your 6 recommendations?
You want to make sure you have natural thyroid supplementation. Men, get your testosterone optimized. Women, progesterone, and if necessary, estrogen. You want to make sure that you're detoxifying your body from things that don't belong. You want to also be giving yourself the vitamins and minerals your body needs, and stay away from unnecessary prescription drugs, and most of them are unnecessary.
Dr. Ellsworth, thank you so much for your very informative recommendations on how to prevent heart disease. And I want to recommend to each one of you that you listen to this again when you have an opportunity and review it and practice exactly what Dr. Ellsworth has told you. And I can assure you this will dramatically increase your opportunity to have a good, healthy heart. Well, now that you know some of the ways to prevent heart disease, Shelley Johnson, our registered dietitian, will be preparing a meal that is not only great for the yeast-free diet, but great for your heart too. You'll want to stay tuned for this.